Dr. Sy, if you're ready, we'll do this.
Yes.
All right, so tell me about this. I mean, we're in the Carolinas. We cover both North and South Carolina. We know South Carolina is in the state as a whole is in that tipping point category. One of our largest counties where we're based in North Carolina is Mecklenburg, which is in the tipping point as well. What are we supposed to get out of this when we look at something like that and we see this terminology?
We wanted to convey the risk or threat level from the prevalence, which is the burden of COVID-19 cases, and tie that to a sense of what that means for the public in terms of what the appropriate response needs to be. What the tipping point category, which are these counties which are highlighted in red, is that the burden of cases may be so large that testing alone and contact tracing alone may not be enough to contain the epidemic. So what we need to do is tie in strict adherence to public health measures, such as masking and even considering social distancing to be able to get our arms around the epidemic again in order to gain control and make sure that the cases, instead of going up, are going back down.
Now, Dr. Sy, in North Carolina, Governor Cooper put a stay-at-home order into effect several months ago. It has been lifted. It's been lifted for more than a month now. Recently, they put a mask mandate in effect in the state. What would your advice be to the governor?
To basically let the data guide the decision making. A few months ago was enough to think about the pandemic on a national level or a state level. But what's emerged over the last several weeks is a very local story of how the pandemic is playing out county by county. We're seeing increasing cases in South Carolina that may be spilling over the southern border into Mecklenburg County in North Carolina, which means there needs to be a targeted effort to really contain the pandemic before it spreads further throughout the rest of the state. This means that increasing the number of testing, the decreasing the time it takes for contact tracing to get back the information to individuals, and then also making sure that individuals are actually following through with the best guidance of physical distancing as well as wearing masks. And if the pandemic is starting to grow out of control in other places, it may mean not just putting a pause on reopening, but potentially even dialing back up into a more localized shutdown until we can buy time again to contain the pandemic.
So your recommendation would be stay-at-home orders?
If the data shows that, then I think that's what's indicated.
Of course, a lot of people are, they've been wanting to go back to work, go to bars and restaurants. They were just given that opportunity about a month and a half ago in the state of North Carolina. Do you think that's why we're seeing the spread starting to make this uptick?
Yeah, we can look to other states of what happens when you don't test enough and you reopen too soon. The example of Arizona with its rising number of cases, rising number of cases in Texas and Florida, all show what happens if we open too soon without the appropriate safety nets and breaks to stop the pandemic from growing. So I understand there is a very real sense of fatigue to the pandemic, but the best way to return to society as normal, to reopen the economy, is to actually gain control of the pandemic. It's not enough to just keep a lid on the pot and try to keep it from boiling over. We have to turn the temperature down. And that may mean a localized shutdown in certain jurisdictions.
So I'm curious what the data shows when it comes to a shutdown. Is that how they solve this issue, say, in New York?
Yes, there is emerging data that a shutdown is effective in not just keeping individuals at home and decreasing the amount of community transmission, but is now increasingly linked to being able to control the pandemic. We've seen it play out in states in the Northeast, in Massachusetts, in New York, for example, and more importantly, in other states around the country and other countries around the world. Once a pandemic gets to such a large extent, you may have to reinstitute a shutdown to put a lid back on the pot and then ramp up testing concurrently and contact tracing so we can actually contain it. There's no silver bullet to fighting the pandemic. We have to use all the tools we have in the toolbox in order to make sure we come on the other side. What happened is we started off with a peak of cases, we settled for a plateau, and it's now turning into a mountain range.
It's a good way to put it, but I'm curious what the end game is. The reason they lifted the stay-at-home order more than a month ago was that the cases were on a downward trend, and they thought it was at that point safe to do so. Then we saw the cases go right back up. So if a stay-at-home order were re-implemented, when is it safe to lift?
We have to let the data guide us, and that means at least 2 weeks of declining COVID cases, or at least 2 weeks of declining test positive rate. That's a proportion of tests are coming back as positive cases. We don't have to conjecture about what the result can look like. Just look to what Massachusetts and New York and New Jersey was able to do. In March, April, these states were facing a crisis level of cases with patients crowding hospitals and the real fear of needing to ration resources like ventilators and ICU beds. But with a concerted effort to ramp up testing, to shut down the spread of cases, now these states have some of the lowest prevalence of COVID cases around the country. So this shows you that what a successful intervention can look like, but nobody can rest on their laurels. What COVID-19 has shown is that we need to stay vigilant, regardless of whether state or whichever county you're in, because the pandemic can quickly get ahead of us if we're not vigilant.
Now, looking at your map, I mean, you could almost draw a straight line all the way across the country, and everything south of there has multiple red counties, some whole red states. In fact, all the states that are in red are below that line. Why is that? These are the Sun Belt states. Is it travel? Are people vacationing? Is that what's going on?
We're seeing some increased mobility. So people leaving the home, being more active. A lot of these states also had earlier phased reopening. And at the time, some of these states were following the guidances in terms of only reopening when there was a low prevalence, a low burden of COVID-19 cases. But we have to keep in mind that that was contingent upon ramping up the testing infrastructure and the testing capacity and contact tracing infrastructure at the same time. It was not enough to have a low burden of cases and reopen, because what happens is that you're flying blind. Cases may be spreading in the community and you're just not aware of it because the testing wasn't there. So we're seeing the effects of reopening too soon without the right information.
Anything else you want to add? I mean, when people hear that you recommend a stay-at-home order, and when they see this data, they may not like that. Is there anything you would like to add or say to those people who are fatigued, as you put it?
The key point is that the message may seem like it's changing, but it's not changing if we focus on being transparent about what the metrics are. We need to let the data guide us. That is, let the actual amount of positive cases in each county, in each state, guide what the response is going to be. The response is going to change, and it's going to vary, as it should, based on what the burden of cases are. If counties in North Carolina show a rising number of cases, then we have to institute masking, testing, and possibly even local shutdowns. But if the trajectory goes down and stays down consistently over 2 weeks, then it may mean it's time to reopen again. So there's no dogma here. There's no philosophical approach. The main dogma is letting the data guide our decisions.
All right. Dr. Tsai, thank you for your time this afternoon. Really appreciate it.
Great. Thank you.